Welcome to Psych for Psychology, a Nystrom & Associates podcast. Our host, Brett Cushing, is a licensed marriage and family therapist at Nystrom. Each week, he talks about all things mental health and therapy with guests, and you get a chance to dive into specific psychology topics that help promote personal development and wellness. And now, your host, Brett.
Welcome to another episode of Psych for Psychology. We are really glad to have you here, and we are really especially glad to have our guest with us today. And I say that because I'm still thinking I'm coming off of my Advil PM that I took before I went to bed while I take a sip of my Starbucks coffee here this morning. So many of us, I'm sure, can relate because we seem to have trouble with sleep, but that's okay. Because we have this plethora of monster drinks and caffeine and energy drinks, and all of it really points to the topic today that we're addressing, and we'll probably do this numerous times, the topic of sleep. And so we have a ringer.
We have a ringer.
A
hidden gem, if you will.
We have Rick the Ringer.
Rick the Ringer, yes.
Also known as Dr. Richard Blackburn, and he's going to be speaking to us about sleep. He's a licensed psychologist. He's a fellow of the Society of Behavioral Sleep Medicine, and he's a diplomate with the Board of Behavioral Sleep Medicine, doing a lot here with Nystrom and Associates, addressing the topic of sleep. So, Rick, we are delighted to have you here with us today.
Well, thank you for having me. I'm excited to be here. I've listened to the podcasts. They're amazing. So it's a privilege for me to be here, and I appreciate the opportunity.
Well, maybe we just jump in on speaking of opportunity. You're really developing an opportunity here at Nystrom to help people with this really relevant topic of sleep. And maybe we'd start with what sort of, you're a psychologist, what brought you to this specialty?
Well, it was accidental. I was working in a locked state chemical dependency facility, and some of the patients were abusing their sleep medications. And so they decided that they were going to remove patients from sleep medications, but they wanted something to offer in return. And so they asked me to find behavioral treatments for sleep disorders. And it just so happened that at this time, it was just as the field of behavioral sleep medicine was really starting to blossom. And I stumbled across it and started studying on my own. And then I came and I took a job with another organization here in the cities. And when I was interviewing, I was mentioning my interest in sleep. And they said, well, we have a group of 6 other people who are training for board certification in sleep. And if you want to join that, we'll pay for it. And so it was this perfect mix where all of a sudden this opportunity appeared before me. The man who trained us was Dr. Michael Schmitz. And he's still in the field in the area, but he really at one point, this health organization had the most behavioral sleep providers in the nation, and it was all because of this opportunity that organization created. And so what's really exciting for me is that Nystrom's is doing that same thing, only on a much larger scale. So my hope is that at some point in the near future, Nystrom's will be the organization that has the most behavioral sleep providers. So I'm really excited about the opportunity, but getting into the field, it's so gratifying because when you do a lot of therapies, it sometimes takes years or months, and behavioral treatments are relatively quick, and almost everyone sees positive results. So it's really a gratifying field to be in.
Wow. That's so cool. I was really excited when you were talking about how Nystrom's hopefully will be be known for having the most sleep, specialist providers. And I think you're really starting off something amazing in Cambridge. That he's in the Cambridge office.
Yes, thank you.
Yeah, of course. Yeah, no problem.
But we already have 7 behavioral sleep providers spread out across Minnesota, and Nystrom's is in a couple months. I'm going to be going down and starting to train a group in Iowa.
Wow!
Oh, fantastic!
So it'll be neat to see this develop. But I really have to credit the administration of Nystrom's because they have thrown resources at this because they see the value. And so for me, one of my career goals was always to train a large group of clinicians, and I stumbled across it again. So I'm excited for that.
Well, we're excited. Yeah, I know you have a few Dr. Blackburn disciples. One of them is even at the highly acclaimed, very prestigious Lakeville office. That is really a shining gem of Nystrom and Associates. Her name is Emily Houston. So, yeah, it's great that it is spreading. Now, help people understand, what does the specialty of behavioral sleep medicine treats, and why is it important? I'm sure people are listening like, oh man, can he really help me with my sleep?
Right. So behavioral sleep medicine treats multiple sleep disorders, and we use behavioral, cognitive, and physiologic interventions to overcome sleep problems. So we're manipulating the way people behave, the way they think, and we're also dealing with internal body processes like making them more prone to sleep. The most common sleep disorder is insomnia, but behavioral sleep medicine also treats abnormal sleep behaviors like sleepwalking, night terrors, nightmares. People who are on CPAP and can't tolerate their machine, we help them get used to that so they can breathe better at night. And we also treat what are called circadian rhythm disorders, which is where the timing of your sleep doesn't match up with your opportunity for sleep. So like an extreme night owl that has to get up for school at 7 a.m. So the neat thing about it is, in terms of mental health, since Nystrom's is a mental health organization, there's 147 mental health diagnoses that list insomnia or another sleep disorder as a symptom. So there's a little over 300 sleep disorders. So just under half of those disorders have sleep as a symptom of the problem. And what's really amazing is research has continually shown that people who have problems with sleep have a greater risk for developing a mental health disorder. It also shows that if you treat the sleep problem, it can significantly improve the mental health disorder. And it can also, for people who are in remission, like people who are depressed but now aren't, it can reduce the risk of that depression coming back. 50% of people who have chronic insomnia suffer from depression or anxiety. And we know that trauma, which is very prevalent out there, tends to increase the risk of insomnia and nightmares. But it's not only that, because if we go beyond the mental health, we've known for a long, long time that problems with sleep or poor sleep quality or short sleep duration increases the risk of medical problems such as heart disease, stroke, diabetes, Alzheimer's, obesity. It worsens chronic pain and autoimmune disorders. And we've known that treating sleep problems tends to improve these conditions. And so when you look at even the patients within Nystrom's, a lot of people who have mental health problems also have physical health problems. So to be able to go to one place and be able to improve all those conditions is really an amazing thing. Sleep is now considered a vital sign because it affects all aspects of health. And again, I think Nystrom's is really forward thinking, because when they've added in things like dietary or dietitians and occupational therapy, Nystrom's is really starting to take a holistic look at health. And sleep is really kind of the capstone that oversees all of that.
I really appreciate you highlighting this, because I think with the plethora of energy drinks and different kinds of coffee and all these things we're trying to do, 5-hour energy little pills you take, it's like we're not seeing that we are running low on energy. And it almost seems, as I talk to people, because we're so driven as Americans to go, 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 sleep just almost seems optional rather than essential. And I hear people say, well, I really only need 5 hours or 6 hours sleep, I'll be fine. And so it just seems like we don't stress the importance of it, while you've just really highlighted how integral sleep is to so many areas of our lives. How much sleep do you think people need?
Well, that depends on their age. For adults, the American Academy of Sleep Medicine did a study, and they looked at all the negative health consequences of not getting enough sleep. And they found that for the majority of people, those health consequences are mitigated if they're getting between 7 and 9 hours of sleep per night. So what we know is that short sleep duration, so people who get fewer than 6 hours, have a significantly increased risk of developing other health and mental health conditions. And it seems like the sleep deprivation is a driver in that. So let's take Alzheimer's, for example. A few years ago, they discovered a new system in the body called the glial lymphatic system. And it's a fancy name, but basically, when you go into deep sleep, these ventricles in your brain, which are these openings, open up and they become larger, and cerebral spinal fluid goes up into the brain. And then when you come out of slow wave sleep, those ventricles shrink down and it squeezes that fluid out of the brain and down into the waste system of the body. And when they sampled that, they found that there were a bunch of what are called beta amyloids within that fluid. And we now know that the buildup of beta amyloids causes these plaques and tangles that cause Alzheimer's. So they have found that when you get deep sleep, it actually cleanses the brain of this debris that can build up and cause Alzheimer's disease.
So, I mean, a beautiful way of saying deep sleep is crucial even for possibly preventing some of those chronic conditions such as Alzheimer's. Is that right? Yeah.
And what's interesting, Brett mentioned that it seems like Americans glorify not sleeping, and that's true. There's actually people who have done historical perspectives of the American culture, and even if you go back to the founding fathers, they found that people who slept more, they labeled them as lazy, and so they've listed for a long time that not sleeping very much or getting little sleep made a person more effective, and we now know that that's not true. But it's interesting because there was a news story just the other day I was reading about Bill Gates, who always prided himself on not sleeping. And he has now come back and realized that it actually has affected his health negatively. And even Arianna Huffington of the Huffington Post wrote a book because she actually ended up collapsing from working herself too hard. So there is a need for sleep. And the reason, Brett, that people are using sports supplements or these energy drinks is because a majority of Americans are sleep deprived, and we seem to think that that's a positive trait when it really isn't.
Yeah, I think that is such a great point. I know that I was just thinking about this last week, even for myself, and it's been a really busy week on various levels. At work, it's Employee Appreciation Week, and it's, we've got lots going on. And so I was just thinking about how I haven't gotten very much sleep this week for a variety of reasons, but that is like not a big deal to me at all. Just in terms of thinking about my own routines and my own health, it's kind of like, oh, well, I didn't get much sleep this week, but oh, well, I'll catch up, and it's like, but other things I might take way more seriously. It's just interesting.
Well, that is interesting. If I can just, because I hear that a lot. Oh, I'll catch up.
Yeah.
Is that a misnomer? I mean, can you just quickly comment on that? Because I hear that line a lot. Oh, I'll catch up. Any thoughts on that?
So if it's something like what Krista was saying, where it's a week and there's a lot of things going on and you're shorting yourself of sleep for a short period of time, you can catch up, and actually sleep can recover fairly quickly. The problem is when it's not just 1 week here and there, when it becomes a chronic lifestyle pattern. And then once you get into that where you're chronically sleep deprived, it is almost impossible to catch up.
Wow. Why is it so hard to catch up once you're chronically sleep deprived? Yeah.
Well, a lot of it because we develop these habits.
Yeah.
And these habits are used to help us with short-term sleep deprivation. So take right now, I'm drinking a Monster energy drink because I wanted to be awake and alert for this.
Cheers.
Cheers.
Cheers. Yeah. That's not a problem. But if I get to where I'm supplementing caffeine all day long to function because I'm not getting sleep, caffeine is a long half-life. This Monster that I am drinking right now, some of it is still going to be in my system tomorrow.
Wow.
And when it gets across a certain threshold, it starts negatively affecting sleep. So what you get is people develop these habits and behaviors that are meant to compensate for sleep, like taking a long nap in the afternoon. But that ends up then affecting nighttime sleep, and you get stuck in this vicious cycle of sleeping poorly at night and then doing things to compensate for that then wreck the next night.
So, all right, so many questions coming in my mind, and we're going to have so little time. And I really want to get into some practical things people can be doing, because I'm sure people are listening and thinking, what do I do? I just had another question, though, real quick, and that is, what if we stop drinking our coffee and stop drinking our Monster drinks, et cetera? Is there going to be some withdrawal? Is there going to be some backlash for us if we try and stop that?
Yeah, it depends on how much you're using and how big of a withdrawal you're going to have. But, caffeine is the most abused substance in the world. So the thing is whether you're getting it from tea or coffee or energy drinks, caffeine has some positive benefits short term, but it can also, when it comes to sleep, cause a lot of really significant problems. So if people are drinking, 2 pots of coffee a day, if they were just to suddenly quit, they would go through withdrawal. And withdrawal usually includes extreme fatigue, agitation, irritability. But the thing about caffeine withdrawal is it's relatively short. If you were just to quit cold turkey, you'd suffer for 2-3 days, and then you would probably be back to normal.
Well, that's encouraging.
That is encouraging.
So,
and I always tell people they don't have to quit caffeine, they just have to cut back. And they really need to time it so that it's far enough away from their bedtime. So what I tell people who have problems with sleep is you should drink under 200 milligrams of caffeine, which is the equivalent of a cup and a half of coffee. And you should stop it at least 10 hours prior to bed.
Nice. So it's not all bad news for us.
This is
today.
great news. I'm like, I still have a few hours left before I have to quit my caffeine. So I'm really glad, Brett, that you mentioned about people are probably wondering, kind of what do we do? How do we treat this? And I know I've worked with many patients who that is one of their primary concerns coming into therapy. And I sometimes feel just like, oh my goodness, I don't even know kind of where to start. So what could people kind of expect if they're thinking about, let's say I have a patient who's thinking like, okay, there's this sleep program. What is this really going to be like for me?
So most behavioral sleep medicine interventions take about 6 to 10 weeks of weekly sessions to resolve. The interventions usually take a significant amount of effort on the part of the client. And this is where the balance between behavioral treatments and medications kind of becomes muddled, because medications for sleep disorders tend to work very quickly. Usually the first night you take it, it works. But over time, you build up tolerance to the medications and they become less and less effective, which requires an increasing dose. And you get stuck in this cycle until you hit the maximum dose and your prescriber won't go any higher. Additionally, when you stop medications, the sleep problem is just there because it wasn't resolving the cause, it was treating it as a symptom. So unlike medications, behavioral treatments address the cause of the problem. And it does take longer to get the desired results, but the research shows that the results are more noticeable. They're more durable. In other words, they last longer. And in many cases, the sleep problem can be resolved. I have a lot of people that I treat who have chronic insomnia and they've suffered for decades. And when they're done with treatment, they no longer have insomnia.
That's pretty incredible.
That really is, and very hopeful for a lot of people, because I know I pop an Advil PM every night before I go to bed. I started off with a half a pill, then I'm up to 1 pill. Now I'm up to a pill and a half. And yeah, I'm going to max out on that. So what can...
let me scare you a little bit there, Brett.
Okay, thank you.
The over-the-counter sleep supplements that include doxylamine, which is what's in Advil PM, or Benadryl, there's been a significant amount of research that shows that medications that have what's called an anticholinergic effect, in other words, they dry you out, they increase your risk of developing Alzheimer's fourfold. And using a sleep medication like your Advil PM as little as 2 nights a week significantly increases your risk of developing a dementia-related disorder later on in life. So these sleep medications that are over the counter, people think they're safe. They're really not.
Well, yeah, I thought I was safe, and now you're right. I'm just scared. So that's really helpful, and I've been wanting to taper off of that and get off of that. What can I do? What can other people do? Some practical things, like maybe what are the most helpful things that you find for people that we could sort of quote deliver today over the podcast?
Right. So that's a great question. And it's actually one of the biggest peeves out there with people who do sleep therapy, because when you go in and you tell your doctor you're having problems sleeping, you're going to get a brochure that says sleep hygiene on it, right?
Yeah.
Sleep hygiene is like dental hygiene. So it's great if you don't have a sleep problem to follow those rules, but once you have a cavity, brushing your teeth more isn't going to take care of the problem. So sleep hygiene is actually the least effective treatment for people who have a sleep problem. We should teach sleep hygiene to people who sleep well so they don't develop a problem, but it really doesn't help people who already have a problem. But back in 1972, there was a gentleman by the name of Dr. Richard Bootson from the University of Arizona. And unfortunately, he passed away a few years ago. But he developed the first really effective behavioral treatment for sleep, and it was called stimulus control. And stimulus control is essentially a set of 6 rules. For about 80% of people, if they follow those rules to the letter, for a couple months, their sleep is going to significantly improve. So rule number 1 is set a standard wake time and get up at that time 7 days a week, regardless of how you slept the night before. The time that we get up in the morning is the time that sets our circadian clock. When light first strikes the retina of our eye, it sends a signal to the brain that restarts a 24-hour day. And most people's internal clocks either run faster or slower than 24 hours. But if you get up at the exact same time every day, it resets your body, and then everything tends to happen on a schedule. Rule number 2 is use the bed for sleeping and intimate activities only. Don't read, eat, watch TV, or do other things in bed. Because when you do that, what you're doing is you're training your bed to be awake and alert and active in a particular location. So this goes back to Pavlov and his dogs, but it's like if every time you saw me, I gave you a painful electric shock, you would get anxious at the thought of seeing me, right?
Yep.
Even if I was nowhere there, if you were just thinking about seeing me, you would get anxious. Well, humans are just as easily programmed as dogs. And when you're doing all these activities in bed, what you're really doing is teaching your brain to become more active. So insomniacs will often say things to me like, I was falling asleep on the couch. I couldn't keep my eyes open. I get up, I stumble to bed. And as soon as I get into bed, my brain becomes active. It's because we programmed it to happen in that location. The third rule is get up when you can't sleep. Anytime you're awake more than 15 to 20 minutes, whether you're trying to fall asleep or you're awake in the middle of the night, get up, get out of bed, go do something more enjoyable. Because if you lie awake in bed, a couple things are going to happen. So one is when you're lying there in the dark, your brain gets bored. And because it gets bored, it goes out and starts looking for more things to do, and it becomes more active. The human brain doesn't all go to sleep at the same time. The frontal lobes of your brain, the part that allows you to be rational, to think, to control your emotional response, It goes to bed when the sun goes down. So we never make good decisions late at night. That's just a rule everyone should know. The part that stays online all night is the part that scans the environment for threats. So you're lying there in the dark, your brain is bored, and the part that's awake is the part that goes, this is not going to go well for you. And so worry increases. The other thing that happens when we lie awake in bed is that we start trying to sleep. And if you've probably had this experience where you're lying in bed, you're not sleeping, you look at the clock and you think, I only got 3 more hours. I got to get more sleep. And as soon as you do that, you get this physiological anxiety arousal, and that wakes you up. And then again, going back to even not doing other activities in bed, if you're lying in bed and you're getting anxious and frustrated, you're training yourself to be anxious and frustrated in bed.
That's a really good point. I know I've noticed that in myself. And, oh, man, I just like you said, 3 hours, what am I going to do? And panic sets in. I've actually tried to do something we talked about once before on the podcast with Dr. Karen Ryan about radical acceptance, and just be like, well, there's not much I can do about this. I just have to accept it. And you're saying we need to maybe get out of bed. If it's more than 15 minutes, get out of bed and do something that's pleasurable.
Right. I tell people I would much rather have them being awake and doing something they enjoy than lying in bed and being torqued that they're not able to sleep.
But won't that activate me more? I'm worried if I get out of bed and I do something pleasurable, now I am going to be up for the rest of those 3 hours because I'm going to be really engaged in something.
It's not, because when you lie in bed, a lot of people will doze in and out of sleep. So when we're awake, our brain builds up these chemicals that make us feel increasingly sleepy. When you fall asleep, those chemicals drop off very quickly. So if you think about it, the average adult, if they're lucky, sleeps 8 hours a night and they're awake 16 hours. So those chemicals drop off at about twice the rate they accumulate. So if you're lying in bed and you're dozing in and out of sleep, it's like a slow leak in a tire. The pressure just gradually goes down and it becomes less likely that you're going to go to sleep. If you get up for a while, that pressure will build so that when you do go back to bed, you're able to sleep more solidly. So there's actually been a research that an hour awake during the day will get you a half hour of sleep at night. An hour awake during the night will get you an extra hour of sleep.
Wow, that is so fascinating, isn't it?
Yeah,
I had no idea.
Research that has measured that.
Wow. Did we let you finish the 6 rules?
I think you had 2 more.
Okay.
Well, 3 more. Don't worry, plan, or ruminate in bed. If your mind is active, no good is going to come out of lying in bed when your anxiety center is active. And then avoid daytime napping. And then this is the big one. Go to bed only when you're sleepy, but not before the suggested time or before your normal bedtime. So people always say, well, I go to bed and I get up at the same time every day. Getting up at the same time every day is critical because that's what sets our internal clocks. The time you go to bed is not as important. So if your bedtime rolls around and you're wide awake, if you go to bed, guess what? You're going to be wide awake. So you stay up until you're actually sleepy. And this is where we spend time with people telling them there's a huge difference between tired, fatigued, and sleepy. Tired and fatigued are energy states. You can be tired and fatigued and wide awake. Sleepy is difficulty maintaining wakefulness. And so what we tell people to do is people will say, I went to bed last night because I was exhausted. And I'll say, yeah, but were you sleepy? And they'll say, no, I was wide awake. And did you sleep? Well, no. So you need to actually go to bed when you're actually sleepy. Now, the thing about this is that if you follow these rules, you're going to have some bad nights because you're getting up during the night, you're not napping, you're not sleeping in, you're not going to bed early, so you don't get to compensate for a bad night. But one of the biggest researchers of this treatment for insomnia is Michael Perlis out of Penn State. And he has this great saying, if not tonight, then tomorrow. So that's that radical acceptance you were talking about, Brett, is to realize that tonight might not be my night. But if I don't compensate by sleeping in, napping, or going to bed early, When I go to bed the next night, I'm going to have greater sleep pressure, and there's a greater chance that I'm going to sleep. And most people have experienced this because they'll say, yeah, I had 2 really bad nights and then I slept great. That's because you followed those rules and your body was ready for sleep when you went to bed.
So I have a question about getting up early or getting up at the same time every day. Because I know that I'm terrible with this. Like I like tack on extra time to sleep in if I think I need more sleep. So how long, well, 2 questions. How long does it take for, let's say I'm going to get up at 5 a.m. every day, but I'm not going to bed early enough to really compensate or to like get enough hours. Will my body kind of figure it out if I'm really consistent getting up at 5 every day?
Yes. And I think that's a great question because it really separates out 2 groups of people. So those rules said don't nap and don't sleep in.
Mm-hmm.
And if you were a person who is chronically sleep deprived, or even temporarily like you were this week because of all the things going on at work,
mm-hmm.
napping and sleeping in are a healthy way to make up for lost sleep. Those 6 rules that I went over are for people who have problems with sleep.
Oh, okay, thank you.
If you have difficulty sleeping at night or you have to take a medication to sleep, you should follow those 6 rules.
Mm-hmm.
If you're a person who just doesn't have good opportunity for sleep, get it when you can.
Got it. That's helpful.
This is also helpful and incredibly practical. And we'd like to keep going with you, Dr. Blackburn, if that's okay. We're going to just divide this into 2 podcasts because I don't know if it's the caffeine or if it's the topic, but I'm really engaged, and I'm sure other people are because this is so relevant. So we're gonna keep going since we have time. And you're okay with that? You still have time?
Absolutely. I've got all the time in the world. I can talk about sleep in my sleep.
Wow, nice.
You probably have.
I'm making a t-shirt saying that.
Yes. Oh, yes. That's a perfect t-shirt opportunity.
Thank you as always for listening, and please be sure to leave us a review. While this podcast can't be a replacement for therapy, we hope you enjoyed our discussion today and join us again next time. Nystrom & Associates is always available to those who are struggling. If you find yourself in need of support and help, please check us out at nystromcounseling.com.